And thanks everyone again for joining us. I'm Patricia Tennen with Kentucky Youth Advocates. I'm the Chief Operating Officer. And today we're going to have our second sector-based policy discussion with state legislators. We are thrilled to have two longstanding champions for children joining us today. First, Chair of the Health and Family Services Committee, Representative Kim Moser of Taylor Mill, who represents Boone and Kenton counties. And we are expecting, as soon as she finishes up another meeting, we'll also welcome Representative Melinda Prunty from Belton, who is the Vice Chair of the Health and Family Services Committee and represents Hopkins and Muhlenberg counties. So the goal of today's discussion is to learn about health policy priorities and hear from these two legislators about the 2021 General Assembly and why we need you, everyone on this forum, to be an advocate for Kentucky's kids and families. We're going to take questions and comments via the chat feature, and we'll try to answer those as we go, either in the chat or afterwards. And today, moderating is going to be my colleague, Mahak Kalra.
Thanks, Patricia. And hello, Representative. It's so great to virtually see you today. We're excited to have you participate in Children's Advocacy Week, especially the health policy question and answer portion of today's discussion. I'm always intrigued about how others introduce themselves. So I just wanted to start by asking you to introduce yourselves to our statewide advocates joining us today.
Okay, well, good morning. I think it's still morning, and it's a thrill to be here with you. I really appreciate the opportunity, and of course I appreciate all of the advocacy efforts on behalf of you and or on the part of your group, I should say, and on behalf of the children of Kentucky. You do great work, so thanks for that. Let's see, I think I would start by introducing myself as the proud mom of 5 sons. 5 grown sons, and the spouse of my husband of 36 years. I would say that these are 2 really important and challenging achievements in my life, and I'm really proud of that. I worked for many years as a neonatal intensive care nurse and flight nurse. I also served as the director of drug control policy in Northern Kentucky before I was elected to the legislature in 2016. I currently chair the House Health and Family Services Committee, and I think that's my background. I'm very passionate about medical and healthcare policy. I've worked in that space. It feels like all of my life. I really grew up in a household of community-minded volunteers and public servants. My dad, Dr. Floyd Poore, was a physician, and he served at many roles in the community, even served as the Kentucky Secretary of Transportation. And my mother was a nurse. She was very involved in philanthropic and service-related projects in the community as well. So I think I kind of followed in their footsteps in both healthcare and in public service. I'm married to a physician, and I've done a great deal of volunteer work in and around educating and advocating for medical policy, even before I served in the legislature. I served as the presidents of the Northern Kentucky, the Kentucky, and the American Medical Association alliances, doing really philanthropic but medical legislative education kind of across the board. I was also elected as the first non-physician to chair a physicians PAC in the nation, and that was KPAC. So I've got kind of a long line of community service in my family.
Thank you for that. So it seems that health has been kind of ingrained in who you are from the get-go, from your parents, but also professionally, and who you surround yourself with your husband as well, and all the other groups that you're a part of. That's amazing. I
can't get away from it.
That's great. And so want to kind of dive into really our, what we say at Kentucky Youth Advocates is what gets measured gets changed. And so as you saw in our latest Kids Count data book on our health page, we touched on the COVID-19 pandemic resulting in people, delaying routine care and the use of telehealth increasing substantially this year, in large part due to the regulations that have changed to make it more accessible. Have you seen the impact of telehealth usage in your community? And how have your constituents really responded to telehealth?
Mm-hmm. That's a great question. We have seen tremendous upticks in the use of telehealth and just in improving access to care, especially during COVID. It is something that's been around for a while, but certainly during the closures and the inability of folks to get together in person, it really became necessary to use telehealth in a more robust way. I think it's overall a great example of a way to improve access to healthcare even in the best of times. I surveyed my district on quite a few issues, and I saw a very positive response to the use of telehealth. Patients are more likely to follow through on appointments. They're more compliant with their treatment. And oftentimes, behavioral health therapy was more positively received when a patient was in their relaxed home setting. It eliminates the barrier of transportation issues for some patients. And it's not perfect by any stretch, but and broadband issues and access continues to be a challenge in certain regions of our state, but overall it's been very positive. So I think that it's probably here to stay. We're working on a bill to really codify the ability of practitioners to use telehealth.
Thank you for that. And I'm excited to hear that you did a survey of your constituents. Obviously, it goes back to our point of how data drives change. And so that's exciting to hear. We also have Representative Prunty here now. And so I just wanted to take a second to say hello, welcome.
Good morning. Sorry I'm late.
No, we totally understand. I know it's the legislative session, so we're excited to still have you a part of the conversation and join. Before we dive in a little deeper, I just wanted to touch on the two questions that I just asked Representative Moser. First, I'm quite intrigued to see how others introduce themselves. So I just wanted you to start off by introducing yourself to our statewide advocates and also talk about what drew you to public service and in particular health.
Okay. I was raised in Ashland, Kentucky, and I was a physical therapist by profession, went to UK, met my husband who's a physician, family practice physician. We went to Georgia for 3 years for residency and settled in Western Kentucky. I served as a physical therapist for nearly 20 years, and then felt called to youth ministry was my passion. I kind of did it on the side, and was asked to be the director of youth ministry for the Diocese of Owensboro, which I served almost 20 years doing that, and got my master's in theology during that process. So I'm all about kids. I did a lot of pediatrics as a physical therapist, treated a lot of kids with physical challenges. I was in a lot of homes, sat in a lot of floors, did home health PT for 10 years. And then with teenagers, kids need to feel like they belong somewhere, and youth ministry, like I say, we did that for over 20 years, both personally in our home parish, and then I did it as the director of youth ministry. So health, I have a health background in physical therapy, and then my husband's a physician, so I've kind of lived that life as well. So I was drawn into public service. I never thought I would serve as a legislator. If you'd asked me that, I would have said you were crazy. It was over the issue of abortion. Run on that issue, and ironically, or however you want to say it, my very first vote was the ultrasound bill, and I missed our adopted twin grandson's first birthday party voting on the 20-week pain bill. So I don't feel like any of those were coincidences myself. And that's kind of my story in a nutshell. So appreciate the opportunity to be here.
Well, we appreciate you. And it seems like your path was very similar to Representative Moser, and, health hasn't been ingrained in just everything that you've done thus far. So I appreciate your perspective and insight that you bring to the table. And I'm excited to have both of you all here today. And Representative Prunty, I also wanted to ask about the telehealth question that I just asked Representative Moser. We've seen a lot of delay in routine care, and so telehealth has spiked based off of our kids count data, is what we're seeing. And so how have you seen that in your community, and how have your constituents responded to telehealth?
I serve on the Muhlenberg County Health Coalition. We have a health coalition, and those serving on that, many counselors are sexual abuse, physical abuse, spouse abuse, sanctuary, our sanctuary shelter. Those folks have been on those Zoom calls, and they're talking about, they share that they have been providing their services via telehealth, and they're getting good results. So I know that's the main way I'm aware of it in my own home district. Personally, my parents are in their 90s, and they have kept appointments by using telehealth. So it's been received well. I do know, though, that sometimes you have to have the hands on the eyeball. So you have to figure out when to actually have it in person. I think there's pluses and minuses, and we have to be aware of that. So but that's how I'm seeing it at home. So.
That's great to hear. The accessibility, it seems like, has been such a critical piece of telehealth. And I totally agree. I think there's an appropriate time for telehealth, and there's a time and place for it. So I think we're now moving into 21st century, and it's exciting to see that Kentucky's moving along in that process. So I wanted to ask, since we're so solutions focused here at Kentucky Youth Advocates, what are some solutions that we could target to strengthen, whether it's telehealth or indicators such as low birth weight babies or access to health care? Can you both kind of dive in, and whoever wants to start first, go for it?
Well, I can go first if you don't mind. I think that telehealth would utilization of telehealth and some of these virtual meetings that we've all kind of become so accustomed to, because some of our at-risk moms and families do have transportation issues. They have other children, and they can't, they have childcare issues. I think that utilizing the virtual platform and even telehealth to help educate folks, do some prenatal care, prenatal teaching, just to identify or help really continue touching base with those at-risk families, especially during prenatal care, would probably address some of the issues in and around low birth weight, identify factors that are contributing to that. Whether it's for nutrition or substance use disorders or something that you can refer individuals out for other resources. I think that it's not a terrible way to connect with folks. It's very convenient, and I think you might see more compliance. I'd love to, and I did have some conversations with one of our local providers of the HANDS program to integrate telehealth into some of those visits as well. So HANDS, START, K-STEP, all of these programs that really support families. I just think that the virtual platform is another way to reach folks.
Representative Prunty?
I just concur. I just came from a budget review subcommittee on health and family services, and we heard from Children's Alliance and some specific stories from Ramey E-Step Homes and how they've implemented K-Step and the amount of money that could be saved if they could have an infusion of one-time money. Those programs are working, and I think the telehealth could definitely help make sure that those visits take place and those interventions take place to keep families together, to implement the Family First program and act. And so I concur with that. I saw the question about the internet. I mean, that we're all aware of that internet service, and we're going to address that as best we can financially. with the continuation budget and all the issues that we're facing, but we're aware of it and we are trying to address it. So thank you for bringing that issue up.
Thank you, ladies. And for our advocates joining us today, I do want to mention that if you look at our blueprint for Kentucky's children's policy and budget priorities, you'll see these programs that both of the representatives have mentioned are on our budget priority list, checklist. So feel free to check those out. We know that HAND, START, KTAP, these are all valuable programs for our families in our safety net programs for them. And so we need to continue elevating that. So thank you for mentioning those programs. We surely are supportive of them. And so I also want to touch on, since part 2 of the legislative session has kicked off this week, what are some policies related to kids and families that we see coming before the Health and Family Services Committee?
Well, we have many, as you would expect. We're a little bit limited in our time and our capacity to hear as many bills probably this year, just from a logistics standpoint. Not all of the committee rooms are outfitted with technology, so we have to do a lot of shifting between rooms and cleaning rooms between meetings and that sort of thing. So we're limited in time, but I was looking through all of the bills that have been filed so far, and there seemed to be kind of this overarching theme of identifying and improving access to care and health disparities, and a few reentry bills. So I think that, you know, we're really kind of moving into the identifying and improving some of those issues. And certainly Kentucky's high rates of cancer and diabetes and heart disease are glaring examples of why we should pay attention to things like our state's tobacco use and obesity. And many of these are costly underlying diseases that keep Kentucky in that really unhealthy category. And these are oftentimes preventable. And so I think that when we look at policy, we should always keep that in mind. And so I'm working on a tobacco preemption repeal, which would allow local cities and counties to have local control over their marketing, sales, and distribution of tobacco products. And again, it's, you know, a lot of these tobacco products and vape products are targeting youth. And we understand what a dangerous precedent that sets in just addicting your brain to yet another substance. It puts individuals at risk for all kinds of future addictions, in addition to just the danger that it is and the damage that it causes to your lungs. And Kentucky spends $1.92 billion on tobacco-related illnesses every year, and that's really just the lung issues. So we know how bad tobacco is across the board. So anyway, that's my my one tobacco bill this year. I just passed my mental health parity bill out of banking and insurance just at 10 o'clock. And this will ensure that mental health treatment is covered at the same rate as other medical treatments. And we're working with the Department of Insurance on this and have a great deal of support from them. And it's really just aligning our state Mental Health and Substance Use Parity Act with the federal guidelines. I am working on a resolution to establish a work group within the cabinet. And so I'm working with the cabinet on investigating bridge insurance and ways to support families in that gap between 138% of the poverty level and a little bit higher, who are maybe using Medicaid now during COVID, and we want to help them transition back to their employer-sponsored health insurance, and don't want people to go untreated, but we need to help them not fluctuate back and forth between Medicaid and their employer-sponsored insurance coverage when there's instability in their life and in our joblessness rate right now. So, you know, just looking at the possibilities and maybe setting up some pilot programs with employers. The telehealth bill I mentioned earlier will ensure improvements and permanency in its use, improving access to care. I am also working on a certification of employability, which will help those who are incarcerated or previously incarcerated gather the documents that they need in order to move forward out of incarceration. So any continuing education, job training program, completion like drug treatment, that sort of thing. And so I see this as a way to help those parents who are suffering from a substance use disorder or who have been incarcerated for some reason, get an ID, move forward in life. We have worked with the cabinet. I don't know if you remember an amendment that I put on House Bill 1 last year that required the cabinet to apply for an 1115 waiver to allow Medicaid during incarceration. So all of this happening concurrently will, I think, really strengthen the reentry supports on the way out. And then this bill would also be a connection to jobs and employers, and even we're even looking at giving those second chance employers some limited liability for hiring folks who may have a criminal record. So there's some other things that I'm considering, maybe even adding the lifting the ban on SNAP benefits for felons in that piece of legislation. So it's a work in progress. It's a pretty big bill. And then I am adding a tack on a technical advisory council on reentry and health disparities. So those are a few things that I'm working on. I have a longer list if you ever want to see it, but I would love to have your support and advocacy in any way. So that's in a nutshell what I'm working on. We've got a lot of really good legislation, and I know that Melinda's going to talk about something that she's going to present on Thursday.
Yeah, wow, that's quite a list. You know, I feel like you just read off of our blueprint to some degree and all the policies that we typically support. So thank you for your leadership. Good. I mean, everything that you've mentioned, everything from reentry and making sure there's community-based supports to families, making sure that, you know, the SNAP benefits are still valuable and there, to tobacco preemption. Those are all important pieces that will help children and families. So thank you for your leadership on all these bills that you're working on, and we're happy to support you. Representative Prunty, do you want to?
I'm not quite as busy as the chair, but I am working on a bill. It's not going to be in health. It'll probably be in education, and I don't know if it'll get traction, but I had been approached about re-looking at a bill that Representative Banta sponsored last year, House Bill 434, and because it got cut short, and she felt like she had too much bandwidth to carry it this time, we were going to add, use the committee sub and add language to try to get Medicaid to be able to charge for services in the schools, since that was passed, to try to get some code so they can bill for their professional services they provide, but trying to tighten up the language and make sure that it actually just screens for bullying, violence, those kinds of things. The point being with the school safety bill to allow schools to look for indicators to try to prevent a Marshall County shooting and catch it when they're early, when they're young, and resource the schools so that they can address those issues, but not go in areas they don't need to go, and keep the parents involved. Let the parents know what the assessment is. If there are any red flags, how to address those. So I would really like to have your all's help with that. So anyway, that's the only one that I'm working on that would affect. I mean, I have another bill that I'm working on, but it's a specific to PANS and PANDAS. It's not a global youth initiative. So anyway, I love all the work that Chair Moser is working on, so I will be supporting all of her work. But that's the one piece that I'm working on. So
you guys, you ladies are rock stars, because again, what you just mentioned, Representative Prunty, is something that we've been talking about for the last several years. When Senate Bill 1 of 2019 passed, was, you know, kids really need social emotional support at the school setting. That's where they are traditionally and typically. You know, COVID is the exception, but that's where they are all day. And so if we could screen and prevent illnesses from happening early on, I mean, that's the key. So thank you so much. And we would love to read more about that bill and learn more and see if there's ways that we could support it. And again, that's the same for Representative Moser, all the bills that you're working on. We're happy to help. So thank you for that. That was a great synopsis of all the bills that are coming our way this part 2 of the legislative session. So I want to end by asking, why is it so important for you guys to hear from advocates? And then also, how can advocates get a hold of you?
Well, it's critical that we hear from our advocates. You're working with families and with children who, and you see the needs directly. And you know, we need to be the conduit between you and good policy. And we need to really understand what the gaps and the barriers are in our system and what's going wrong before we can enact good policy. So it really, let me just say, it really makes a difference when we hear from you. And it's important that we hear your stories. I wouldn't maybe type up a 2-page email, because right now we might not have time to read that, but it's, you know, it is good to hear directly from the advocates. Feel free to email me, or you know, working through the folks here. Mahak is very well connected. I know that you have probably had discussions about how to advocate for a piece of legislation. So if you hear about something that you really want to learn more about and follow it through the process and help with it, I would recommend that you go to our LRC website, and you can sign up for notifications so that you can see where the bills are in process. If a bill is in committee and you see that it's been posted, that means it's probably going to be on the agenda in the near future. Just follow that bill. And you can actually even reach out to the committee members before it's on an agenda and just talk about these bills. I know that Mahak and Patricia, you know, would probably like it to be organized. And so, I mean, it's helpful to have an organized conversation about it too. But certainly contacting committee members when you see that a bill that you're following has been posted and put on the agenda for a hearing. It helps us shepherd these bills through. It helps share your stories with other legislators who might not have the medical background that Representative Prunty and I do. Because, you know, we are a citizen legislature and we all come with different backgrounds. And so I don't pretend to know anything about agriculture, but there are people in the legislature who do. So we lean on each other for that information, and we lean on our advocates too.
Such valuable insight. Thank you. Representative Prunty?
You can always call the legislative line. I see green slips and private Facebook messages more than I see emails, because I get so many emails. They just kind of, sometimes they get lost. Yeah. But encourage the advocates to communicate through you all, as Chair Moser said, and also contact their own personal legislators. If they know them personally, that's probably, especially if they serve on a committee, that's probably the best way. Those personal relationships, they're probably going to pay more attention to those personal relationships. So don't hesitate to reach out to their own personal legislators. So I would just add that to the mix.
Absolutely correct.
Well, I am just going to say a big thank you to both of you all. You guys are, you ladies are rock stars, really. And we look to you as champions for kids for so many years, and we're happy to have you a part of our team. So thank you again. Thank you for your access. And I know that you are busy. It's day 10 of the legislative process. And so thank you, thank you, thank you. And I hope you have a great rest of your day.
Thanks for the
Thank you.
opportunity. Thank you.
Thanks, you too. Appreciate
so
being
much.
here. Everyone have a wonderful day. All right.